The world as we know it came to a standstill in the face of the COVID-19 pandemic. Forced to stay apart and stay inside for the safety of all, we as a people faced an unprecedented challenge. Not everyone was confined to their own home though. Frontline workers, doctors, nurses, hospital staff were all fighting the fight against Corona. At Jehangir Hospital, the staff, led by our fearless doctors, continued to provide the best medical care in the city to ensure the safety of our staff and anyone who visits the hospital. Extensive steps have been taken. All personnel is triaged upon entering the hospital. They are screened. Their temperature is checked. Wearing of masks and frequent use of sanitizer is not only encouraged but mandatory. The number of visitors has also been brought down to a single pass-holding visitor per patient, allowing us to systematically maintain social distancing. The cooperation of our patients, their families, and the families of all our staff have allowed us to maintain our position as one of the best hospitals in the city. Foot-operated sanitizer dispensers are placed across the hospital premises and can be easily used. The frequency of disinfecting and sanitizing our premises has been increased. This includes decontamination of all surfaces, including the furniture in our offices and OPDs. All social distancing guidelines prescribed by the government are followed, whether that's in the pharmacy where caretakers come to collect medicines, in the administrative offices, in our non-COVID general wards. PPE gear and other precautionary tools are used by doctors and other medical staff when taking care of patients. In order to contain the spread of the infection, all non-COVID patients and COVID-19 infected or suspected patients are segregated. A special isolation ward has been set up for patients suffering COVID-19 or are suspected to be suffering from the virus. Their admissions into the hospital are also fast-tracked and are done separately from the non-COVID areas. A separate OT, dialysis facilities, and even a separate X-ray unit for the chest X-rays of all COVID suspected patients have been set up to further ensure that non-COVID patients do not come in contact with the COVID-19 designated areas. A fever clinic for faster diagnosis and treatment has also been set up. The patients who recover from the coronavirus and are discharged are given a special briefing regarding home quarantine and the necessary post-hospitalization care they need to take. The infection's ability to spread easily through centralized air conditioning has meant that all areas that are used for COVID-19 treatments use either Windows AC or individual split ACs and are not centrally air conditioned to ensure segregation of COVID areas from non-COVID areas for further safety. We have tried our best to provide all the necessary support to our staff during this time. The staff that live in containment zones have been provided accommodation near the hospital. The staff's diet is also being monitored and they are provided protein-rich meals. The fight against COVID-19 is far from over, but since the beginning, we at Jehangir Hospital have known for sure that no matter how long this process might be, our dedication to providing the best possible medical care to our patients remains unwavering. We will always be on the front lines, taking care of those who need us in the times of Corona and